Hello and welcome to week 3 of PA117. This week we are actually in chapter 3 and it starts on page 37. If you have not received your book yet, that is a problem, so let me know and we can get that ordered for you right away. All right, to jump in, your discussion question talks a little bit about informed consent and talking to a patient about what medication they are to be taking. And so we're going to start off in this chapter really talking about that and how you should answer that. But I also wanted to let you know in the discussion, I'd like for you to talk to me about if you have researched something, you can cite that article. When you've done that, you can then post that article, but I also need your opinion as well. So there are 3 things that need to go into the discussion: the article that you researched, the citing from where you found it, and then also what you think about it. Just copying and pasting from another website isn't a great discussion. And then, of course, give me 2 peer reviews so that you will get everything correct in that discussion question, 25 points worth. Okay, so starting on page 37, chapter 3, some of the things I wanted to talk about first were ethics, morals, and values. Ethics is defined as a set of principles and good conduct, and also as systems of moral values. People commonly adopt ethics as part of a formal system as rules. So I really want to talk to you about how they interchange. So ethics, morals, and values. Morals are good principles or rules of conduct, and then values are desirable standards or quality. So very close to one another. And values might be defined as rules about right and wrong. They're often not thought of until a conflict arises. And you can see down at the table on 3.2, it talks about ethics, morals, and values, and then how that relates to the law. And so if the ethics is the formal study of moral choices that conform to standards of conduct, morals is the principal fundamental standards of right conduct, and then values, concepts that give meaning to life and serve as a framework for decision making. It goes into what law is, which is a body of rules of action or conduct that are prescribed by a controlling authority and have a binding legal force. I love how they put prescribed in there since this is a pharmacy book. And so it talks about the basics and then the summary of that. So the definition, the basics, and then the summary. So giving a summary of each of those, ethics is the judgment of right and wrong. Morals is right conduct standards. Values is life's meaning. And then you go to the law and it's rules with legal force. And that's kind of how they're relating, is what are your ethics, morals, and values? And then the laws are set to that. And then you have to follow them that way. So that's the relationship between that. Going down here, there's some bioethical issues that you can look into. HIV, organ transplants, that kind of stuff. And then you be the judge. I love this, that you can kind of think about it in your own opinion. It says, Phil is a pharmacy technician who is asked by a customer about Plan B, a medication intended for use as a morning after pill. Because Phil believes that the use of morning after medication to prevent contraception is wrong, he describes all sorts of serious adverse effects and states that they happen to most of the people who take the drug. As a result, the patient calls her doctor, who later calls the pharmacy and speaks with the pharmacist, telling him that Phil said and asks for an explanation. In your judgment, was Phil ethically correct in his actions? And what sort of legal repercussions do you think could await Phil as a result of his misstatements about Plan B? Sometimes I kind of wish this was the discussion. That would be pretty intense. But this is also kind of a moral, ethical value question that they want talked about. And so, or discussed, but we're not talking about that. On to chapter 42, the relationship between ethics and law. There is no obvious right or wrong. Justice will not likely be brought about the enforcement of the law, and a right behavior is likely to bring about a wrong effect. Personal sacrifice will result in the following ideals. And so that's, you can read about how that relationship between the ethics and the law, and then professional ethics, going into responsibility. And this is where you can kind of find your discussion. Here we go. Professionals must take informed decision based on specialized training. They must act in proper manner when their action is required to help or save the life of another. The medical profession in each of its separate areas has special codes of professional ethic that must be followed. The characteristics of a professional consist of a set of specific attitudes which are essential for establishing professional ethics. Guidelines for professional ethics are based on principlism, which is the application of 4 distinct moral principles, which is respect for autonomy, injustice, beneficent, and non-malice. It says healthcare providers should be truthful to patients and families. The 4 principles are applied to action and decision making, constituting the foundation for professional ethics. Just going down, talking about privacy, what the code of ethics for the pharmacist and the patient-pharmacist relationship. Talks a little bit about how keeping patient's privacy, medical history, how we're the advocate for the patient, how we can get healthcare providers and pharmacists concerned about the cause and best interest for the patient rights. Moving on to that, respect for other colleagues, serving the community. But the Code of Ethics for Pharmacy Technicians starts on 47. Pharmacy technicians, like pharmacists, should strive to make the care of every patient their utmost concern. They should always treat patients respectfully, responsibly, and honestly. Pharmacy technicians should use their best professional judgment at all times and ask their pharmacists for advice if unsure about anything that occurs. They should encourage patients to speak directly with the pharmacist about any concerns. Professional competence must be continually maintained so that they can deliver the best healthcare service. I love that. And then you can see that they have bullet point a few of these. These are really good to add to resumes. So if you are looking for some skills that you've learned throughout this schooling, delivering competent, safe, and appropriate pharmacy and related services, these are great skills to have going into a pharmacy technician position. Pharmacy technicians must always be honest, even when mistakes occur. This is a big one. Errors should be reported to supervisors immediately. All topics must be discussed without exaggeration or distortion. The patient deserves to know the straight truth, even if it is difficult to hear. Patient dignity is of the utmost importance, and it can only be preserved by honesty and integrity in communication with the patient. And so last week we talked about malpractice and how the pharmacists, we are covered under their malpractice. And so if they put their trust in us to help work for them, and then they're covering up with us with their malpractice, then we have to be honest if an error occurs. And so just like it says here that the patient deserves to know the straight truth, and if it was a mistake, then that's how we come clean about it, and that's how we communicate it. Right. And so going back to making ethical decisions, I love reading about that too. So this one is a long chapter. So I picked out some of the key points I wanted to talk about in this chapter, but then you have, of course, your assignment at the end of the chapter to answer as well. If you have any questions about this week, let me know. I'd love to help you in that way. Law and ethics can be kind of dry, but there are some things that I have dealt with. So I'd love to talk to you more about it. Hope to talk to you soon. Have a great week.